This model focuses on the standard precautions that should be taken at healthcare facilities. At the end of this model, you should be able to describe the standard precautions that should be implemented in healthcare facilities for the care of patients with respiratory illnesses. The goal of standard precautions is to reduce the risk of transmission of microorganisms, which are infectious agents, from both recognized and unrecognized sources of infection. They should be applied every time healthcare is practiced and should become second nature as part of healthcare practice. When implemented correctly, it prevents or limits the spread of infection to other healthcare workers, patients, or visitors by preventing contact with body fluids, secretions, or excretions. Standard precautions are designed to protect staff and patients from contact with infectious agents wherever healthcare is delivered. It is to be used at all times, whether infection is known or not, in order to prevent infection in patients and staff. An infected person can be a direct source of infection in a healthcare facility via their secretions or excretions such as body fluids, blood, saliva or sputum, nasal discharges, wound drainage, urine, and feces. Contaminated objects, usually located within 1 meter of the patient, can serve as indirect sources of infection. Examples include contaminated surfaces, used tissue, contaminated equipment, and other objects in contact with secretions. These are the elements of standard precautions: hand hygiene, respiratory hygiene and cough etiquette, appropriate use of PPE based on risk assessment, patient's placement with adequate ventilation, safe injection practices, safe handling, cleaning and disinfection of patient care equipment, environmental cleaning, waste management including the careful disposal of sharps, and occupational health. The highlighted elements are those that are critical in the care of patients with respiratory illnesses such as the COVID-19. These elements will be discussed next. A healthcare worker's hands are a main tool for delivering healthcare, and they could also serve as a mode of transmission in the chain of infection when opening or closing doors, touching surfaces, or during handshakes. Practicing hand hygiene regularly is the single most effective way to reduce the risk of spreading or acquiring infections, and this is an important IPC measure for COVID-19. Proper hand hygiene reduces the spread of infectious agents and terminates outbreaks by preventing the spread of diseases through human-to-human transmission. The 5 moments of hand hygiene defines the key moments when healthcare workers should perform hand hygiene. The moments include before patient contact, before aseptic procedure, after body fluid exposure risk, after patient contact, and after contact with patient environment. These 5 moments will be discussed in more detail later. But first, let's look at how to properly wash and disinfect the hands. As standard practice, it is important to wash your hands with soap and water using the proper hand washing technique for about 40 to 60 seconds. Hands can also be disinfected using alcohol-based hand sanitizer or rub with the proper technique for about 20 to 30 seconds. Ensure to remove all jewelry before washing hands. These steps should be taken when washing hands with soap and water. Wet your hands with water. Apply enough soap to cover all surfaces of your hands. Rub your hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse your hands with water. Dry thoroughly with a single-use towel or paper towel. Use the towel to turn off the tap. Your hands are now safe. These steps should be taken when disinfecting hands with alcohol-based hand sanitizer or rub. Pour at least 3 ml of alcohol-based hand sanitizer or rub into the cupped palm of the left hand. Dip your right fingertips into the alcohol-based hand sanitizer or rub in your left palm. Tip the alcohol-based hand sanitizer or rub into the other palm and dip your left fingertips. Rub both palms together. Rub the right palm over the back of the left hand together with fingers. Rub the left palm over the back of the right hand together with fingers. Rub over all surfaces of the right thumb. Rub over all surfaces of the left thumb. Rub with clasped fingers of the right hand in left palm and vice versa. Rub over the wrist of both hands. Wait for hands to dry before working. You can also refer to the instructional video on hand hygiene under the materials section for this model. Respiratory hygiene and cough etiquette should be implemented by health workers, patients, and visitors to prevent the transmission of respiratory infections such as the COVID-19 in healthcare settings. The following measures are recommended. When coughing or sneezing, cover your mouth and nose with a disposable tissue or cloth and discard immediately after use in a covered waste bin. If a tissue is not available, cough and sneeze into your upper sleeve or inside your shirt or blouse. Ensure to wash your hands immediately after coughing or sneezing with soap and water or use an alcohol-based hand sanitizer. Patients who are coughing or sneezing should be seated away from others in common waiting areas at a distance of at least 3 feet or 1 meter, or they should be taken to a separate room. An instructional video on how to practice good respiratory hygiene and cough etiquette is available under the materials section for this model. Personal protective equipment should be used to protect the wearer's skin, eyes, mucous membranes, airways, and clothing from coming into contact with infectious agents. Mucous membranes and skin with compromised integrity are portals of entry that are highly susceptible to infectious agents such as COVID-19. It is important to note that the use of PPE is not a substitute for proper IPC practice. For example, the use of gloves is not a substitute for hand hygiene. Healthcare workers who work with COVID-19 patients must be proficient in donning and doffing PPE, as it is recommended in the care and management of suspected or confirmed cases of COVID-19. PPE includes items such as hand gloves, face masks, gown, aprons, overalls, shoe covers, face shield, goggles, and hoods. Gloves are used to protect the skin and hands from exposure to blood and body fluid and to prevent the spread of pathogens to other patients. Gowns, aprons, overalls, hoods, or shoe covers are used to prevent contamination of clothing and protect the body. Masks, goggles, and face shields are used to prevent exposure to potentially infectious materials by blocking droplets, splashes, or sprays from mucous membranes such as the eyes and mouth. Risk assessment is critical for all healthcare activities to determine the appropriate PPE that is needed for adequate protection. The choice and combination of PPE ensemble to be worn when attending to COVID-19 infected patients should be based on a careful risk assessment that considers risk of exposure and extent of contact anticipated with blood, body fluids, respiratory droplets, and/or open skin. After screening and triaging, suspected patients should be placed in well-ventilated isolation rooms. If more than one patient is to be placed in an isolation room, ensure that patient beds are at least 3 feet or 1 meter away from each other. All equipment to be used in the isolation room need to be safely handled. Common patient equipment should be cleaned and disinfected. If possible, there should be a dedicated and separate common patient equipment for the isolation ward, and this should not be shared with the clinical ward. If this is not possible, all equipment such as thermometers and stethoscopes are to be properly cleaned with alcohol between patient use. The patient's environment can be easily contaminated with the infectious pathogens that the patient is infected with. Surfaces close to the patient such as bed rails, drip stands, or bed control buttons are often the most heavily contaminated. Microorganisms can survive for days and even weeks on these surfaces depending on the type of organism and the condition of the surface. SARS-CoV-2 can survive for up to 9 days on contaminated surfaces. Hence, frequently touched surfaces such as bed rails, drip stands, bedside cupboards, toilets, sinks or water basins, computer keyboards, telephones are to be properly cleaned and disinfected. There is a difference between cleaning and disinfection. Cleaning refers to the physical removal of soil from a surface or object, leaving them safe to touch or use. Soap or mild detergents and water are used for cleaning. Disinfection refers to a process that destroys or inactivates infectious agents or microorganisms, except spores, on inanimate surfaces or objects. Environmental disinfection is most often achieved by use of disinfectants containing chemical ingredients of chlorine, ammonia, and phenols. The frequency and intensity of cleaning and disinfection will depend on several factors such as proximity to patients, patient's hygiene level, amount of environmental contamination, patient population, and isolation requirements. Environmental cleaning will be discussed in more detail later. Healthcare facilities should have SOPs for the segregation, transport, storage, and disposal of waste. A color-coded system should be used for the segregation of waste. The recommended color coding system for waste segregation in Nigeria is black for non-risk waste and general waste, yellow for infectious waste. Sharp boxes are sometimes colored yellow. Also, red for highly infectious waste, and brown for pharmaceutical and chemical waste. Training on proper waste management should be provided to waste handlers, healthcare workers, and ancillary staff, including cleaners. A reliable contractor should be employed to handle the final disposal of waste. Ensure to perform documented audits on the contractor. Waste management will be discussed in more detail later. The major takeaway from this model is that healthcare workers should always implement standard precautions when providing patient care, despite the patient's diagnosis, to prevent contact with body fluids, secretions, and excretions, and limit or prevent the spread of infection to others.